It's a presumed case because the Department of Health is still awaiting test results that they believe will confirm the first monkeypox case in the state of Virginia. The woman is a resident of Northern Virginia who recently traveled to an African country where the disease is known to occur. She's currently in isolation at home. The monkeypox is in the same family as smallpox, so most of the time it's treatable, but in comparison, monkeypox is far less contagious. We spoke to the Virginia Department of Health asking them if we should be worried about it possibly producing another pandemic like COVID-19.
There's no indication that monkeypox would cause a pandemic. There's really no indication of that. Yes, we are having an unusual outbreak of cases. The investigation is ongoing about why that is.
Dr. Murphy did say COVID-19 is still a threat and we should still be aware of that risk. But what about all of us here in Hampton Roads now that a monkeypox case has presumably been found in Virginia?
As far as infectiousness and level of concern for Virginia residents, monkeypox is not endemic anywhere in the United States, and the infection has not commonly been reported here in this country. Person-to-person transmission of monkeypox is relatively limited. Usually any one monkeypox patient does not necessarily present a large risk to the general public.
So remember, the Department of Health wants us to be informed about monkeypox, not alarmed. Now, if you're still concerned, Dr. Murphy says the illness usually starts out with fever, headache, muscle aches, exhaustion, just like the flu or COVID-19. But what sets monkeypox apart is the swelling of your lymph nodes. And a day or two later, a rash appears on parts of your body. Now, if you have those symptoms, you should seek medical care, especially if you fall into the following groups. You've traveled to Central or West Africa or parts of Europe where cases have been reported, or you're a man who's been close contact or intimate contact with other men. Or last one, if you've had a close contact with a person who is suspected to have monkeypox. In the studio, Party Cruz, News 3.